I'm Dr. David Hill, and today we're going to be talking about signs and symptoms of a wheat allergy in babies. Now, when we talk about wheat allergy, we really want to divide this up into two different things because there's an allergy to wheat, which is caused by certain parts of the immune system, particularly IgE, mast cells that mediate allergic disease. And then there is a different sort of reaction to wheat called celiac disease, or sprue, non-tropical sprue. That's not really an allergy. It is an immune reaction to wheat, but not part of the allergy. So let's divide this up. First of all, celiac disease is its own thing and deserves a whole different talk. Celiac disease may present with poor growth, with diarrhea, with abdominal pain. It can be really difficult to determine when celiac disease is present. It's best found with blood tests and sometimes even with endoscopy of the intestines, where samples are taken to send off to the pathology lab and see if some of the typical changes of celiac disease are present. We worry about celiac disease particularly in babies who are not growing normally. They seem to be taking normal amounts of calories, and when they were nursing or solely formula fed, they were growing fine, but then they start eating food, and that food may have some wheat protein in it called gluten, and then all of a sudden they stop growing well, they have stomach problems. Those things really tip us off to celiac disease, but that's not the same as a wheat allergy. An allergy presents often with diarrhea. There is some overlap. There may be blood in the stool, which is not typical of celiac disease. There may be vomiting. There may be hives. These are large raised patches on the skin which usually itch. You may also see some itching of the mouth or discomfort there. The hallmark of that sort of wheat allergy is that the reaction usually comes on very quickly after eating something that contains wheat, usually within 15 minutes or so. It's predictable. If you take the wheat out of the diet, the allergy goes away. When you bring the wheat back, the allergy comes back. Now, identifying food allergies is not always a simple thing. It can be very difficult. A food diary can be very helpful. If you keep track of everything the child eats and then look back to see when the symptoms occur, sometimes something will jump out at you. Sometimes diagnosing a food allergy requires some testing. If the manifestation of this allergy is diarrhea or blood in the stool, we definitely are going to want to send the stool to the lab and figure out what's going on. Could there be an infection? Could there be some other problem in the intestines that's not an allergy? The child may need to have some blood testing or even allergy skin testing to determine what the most likely allergens are. And sometimes you find out often that there's more than one. It's not just wheat. Maybe it's wheat and soy and milk and peanuts or some combination of those. Those are all very common food allergens. So you often have to really dig deep to figure out what's going on. That said, if your child seems to have a reaction to certain foods, start keeping a diary and call their doctor so that he or she can help you figure out what's going on. Talking about wheat allergy in children, I'm Dr. David Hill.